Thank you for joining us on this webinar with the Caribbean Policy Consortium on the Caribbean crime conundrum. And I think it's an uncomfortable fact for those of us who work on Latin America and the Caribbean that the Americas, and here I'm not excluding North America, but the Americas, although it's a region that is noted for a relatively low level of interstate war, happens to be the most violent region in the world when you measure homicides. And this is just something that has been apparent for several decades. And within that situation, there are certain countries in the Caribbean that stand out, even within this relatively violent region, when measured by homicide, for being particularly violent. And I just looked at the UN Office on Drugs and Crime data, and you see countries such as Jamaica, St. Vincent, Trinidad and Tobago, with startlingly high levels of homicide. And so I do want to thank the people who are prepared to present today because they've put a lot of time and effort into this and they're specialists in their fields. But before we go to the panel, I wanted to introduce Dr. Ivalaw Lloyd-Griffith, who is the author of Challenge Sovereignty, The Impact of Drugs, Crime, Terrorism, and Cyber Threats in the Caribbean, a book published by the University of Illinois Press, 2024. We had a book launch last year here at FIU, where Dr. Griffith presented this work on the complex problems in the Caribbean, and I wanted to turn it over to him. Thank you, Ivalo.
Thank you, Tony. Good morning to everyone. And I want to begin by thanking Dr. Pereira and FIU LACC for another episode of enabling us to have not only an in-person periodic, but a virtual conversation about issues critical to the region. Now, anyone who is familiar even remotely with the Caribbean knows that crime and violence are among the clear and present dangers facing the Caribbean for quite a while. But generally, when it comes to an analysis of a conversation about crime and violence, the tendency is to appropriately focus on the national security aspects, the law enforcement aspects, the issues of social and public health tend to be at the lower round of the analysis ladder. That has begun to change. And it began to change a couple of years ago when the CARICOM leaders adopted the approach that says, let's crime and violence. And that paradigm view is the one that says we need to view crime and violence as a public health challenge. And I want to thank the panelists who are going to present, and I'll tell you a little bit about them in a minute, today on this public health dimension, this public health paradigm of crime and violence in the Caribbean. But I want to frame my introduction of the panel with the definition of crime and violence as a public health challenge based on something that came out of the symposium, the second symposium, November of last year in Georgetown, Guyana. And they issued a statement, it's called the George Bridge Declaration on the Second Regional Symposium on Crime and Violence as a Public Health Issue. And I want to read you just 2 sentences from that declaration that allow us to appreciate the definition of crime and violence as a public health issue. Here is what those 2 sentences say. The public health approach to violence and crime is a systemic, multidisciplinary, evidence-based framework that seeks to understand, prevent, and mitigate violence and crime by addressing their societal, behavioral, and environmental determinants. This approach applies public health principles such as surveillance, risk, and protective factor identification, intervention and monitoring and evaluation to reduce the incidence, the impact, the recurrence of violence and crime. So the view now, appropriately so, is that we need to take another look at how we address the issue of crime and violence using the lenses of public health. And I'm delighted and thankful that we have a wonderful group of colleagues from the region who are expert in their own respective areas, but who collectively will allow us to have an appropriate conversation that they will lead on this public health approach to crime and violence. The first speaker will be Mr. Calixtus Joseph. He is the Acting Assistant Director of Policy, Strategy, and Innovation at CARICOM Impacts. Calixtus, like the other panelists, have a very long biographical statement that we can take 5 minutes to read, but I just want to mention one thing about Calixtus. Not only is he versatile with the dimensions of crime and national security in the Caribbean, he's been able to lend that expertise beyond the Caribbean in the European context. And I'm delighted that Calixtus has been able to join us from CARICOM Impacts, lend his incredible breadth and length of knowledge on this issue. Following Mr. Joseph will be Dr. Elizabeth Ward, also a long-standing practitioner in the medical sciences. He is Professor of Practice in Violence and Injury Prevention at the University of the West Indies, Mona. Elizabeth also has an incredibly rich bio and spanning not only the world of public university environment, with training from the European, Canadian, and the West Indian context. I'm delighted Elizabeth is able to join us and share the wealth of her presentations in hearing from Mr. Nance Richards. Nance has a dual distinction of being a military officer and a candidate for the PhD in public health. Nance also has the distinction of being able to work in the various languages of the Caribbean. He speaks Spanish, he speaks French, and he's learning Arabic. And I'm delighted that Nance will share some of some of the work he's doing for his doctoral dissertation, but capturing the reality of his native St. Kitts and Nevis, helping us to understand what each of the challenges manifesting themselves in the public health domain is all about. We'll ask each of the panelists to do a 15 to 18 minutes max presentation, after which we'll have an open question and answer conversation that Dr. Pereira and I will moderate. And I'm delighted then to invite our first speaker, Mr. Calixtus Joseph, to take the floor.
Thank you, Professor Griffith, and thank you so much for the warm greetings. Are you able to hear me?
Yes, we're hearing you well.
Okay, thank you so much. Yeah, from the outset, permit me to thank the organizers of this very important webinar, the Florida International University, Latin America and the Caribbean Center, and also the Caribbean Policy Consortium. I'd also like to recognize our two moderators, not just one, but two, Dr. Griffith again, and also Dr. Anthony Pereira. I'd also like to recognize my fellow panelist, Dr. Elizabeth Ward, who is doing tremendous work in Jamaica, and also Mr. Hans Richards from St. Kitts. Thank you very much. I will now share my presentation, and please tell me whether you are seeing my presentation and everything is okay. Okay, thank you very much.
Looks good, Calixtus.
Okay, thank you very much. Violence in the Caribbean is often associated with three intertwined factors of gang violence, drug trafficking, and access to illicit firearms. The rate of violence death in the Caribbean member states, as stated by Dr. Anthony previously, is almost 3 times the global average. Firearms are used in more than half of all homicides on average, and in some countries up to 90% of homicides. So most countries, you'd say between 70 to 90% of homicides are committed by firearms in this region. Sorry, I was just having some PC challenges, unfortunately, but I'm back. Violence leads to a range of injuries, death, and disabilities with direct impact on individuals' physical health. So when we look at the public health implication of violence and crime, we also look at how we could contribute to long-term health problems and mental health conditions. For instance, increasing evidence shows that the harmful effects of exposure to violence can increase the risk of substance abuse also, mental illness and suicidality, chronic diseases like heart diseases, diabetes, and cancer, and social problems such as crime and further violence. Crime generates fear and violence within communities. It undermines development while exacerbating inequalities. Organized crime, we must understand, transcends national borders and has local, regional, and global impact, undermining essential aspects of governance and also environmental sustainability, public health, and even online safety. Negative impact of crime also has huge implication for countries' image and the reputation of countries. Recently, CARICOM Impacts and the Small Arms Survey took some studies, and those case study research conducted by Impacts and Small Arms Survey in the Bahamas, Barbados, and Jamaica revealed that violence crime impose significant public health and economic burdens on CARICOM communities and societies. In 2019, direct medical costs and productivity loss due to firearms-related violence amounted to at least $12 million in Barbados, US $49 million in the Bahamas, and USD $145 million in Jamaica. This figure underestimates the total impact of firearms violence on health. And beyond these deaths, many victims suffer from injuries, disability, ill health due to violence. Now, there is need for more regional policies and training for health professionals. And one of the reasons I'm stating that is that most times when we look at the issue of violence, we only look at the general population. More recently, we've also been looking at the impact of violence on health service providers and even their safety. In many countries, such as I would say even Jamaica, Haiti, and Trinidad, where there have been instances of persons in A&E, that's accident and emergency area, where persons, gang members have retaliated in those areas, putting health practitioners' life at risk. And also we must understand that firearms injuries and other injuries delay critical patients' care, especially in an accident and emergency. I'm getting some feedback from someone mic that's open. Could you please close your mic? Thank you. In terms of injury profile, we must also note that more bystanders and in some cases, children being injured with the use of high-powered weapons in the region. Now, most times I'll take up a point of departure from looking at just firearms injury, but looking at organized crime on a whole. Colleagues, it is misleading and simplistic to portray crime or even organized crime as an underworld of crooks, distinct from the upper world of good guys. So most times when we think of crime, we said, oh, those bad boys. And so it's quite misleading to phrase crime in that perspective. Rather, these realms are symbiotically connected, necessitating a deeper understanding of their intersection and how key players in both worlds, and when I speak about both worlds, both the underworld and the upper world interact and influence each other. The boundaries between the underworld and upper world are often blurred. Not all activities that take place within the ecosystem of crime are illegal, while not all illicit activities are perceived as such by those engaged in them. We all exist within the ecosystem of organized crime. All of us exist within that ecosystem, where professionals worldwide, sometimes inadvertently, but often intentionally, facilitate illicit trade through corrupt practices. When we speak of crime, we must look at both the underworld and the upper world, because a lot of crime is facilitated by illicit practices. What does the data tell us? Organized crime thrive by exploiting the same paths, supply chains, utilize the very trade infrastructure, and rely on the same intermediaries as legal commerce. Whether it's ports, whether it's border crossings, financial institutions, transportation networks, internet and the internet serve as conduits for both legitimate and criminal enterprises alike. Now, with regard to firearms crime, we note that firearms are basically responsible for more than 80% of homicide, compared to the global average of 54%. Now, we must look also at some of the emerging trends in the region, which has increased the lethality. And also, when you hear of the shooting, most likely now you hear of more than one person is murdered in that shooting. Some of the key issues we are looking at right now are issues of 3D printing. And 3D printing is changing the landscape of firearms, but also organized criminality in the region. So innovations like 3D printing is disrupting illicit markets by decentralizing production, reducing the need for traditional suppliers such as firearms. Around 15 years ago, 10 years ago, when we speak about firearms, the first statement we would have made is that we in the Caribbean are not producers of firearms. That's the first statement we'd make. Perhaps the statement we could make now is that we are not large-scale producers of firearms, because 3D printing has changed that notion. And we have recognized and seen 3D labs in the Caribbean, in at least more than 3 countries in the Caribbean. So guns are being produced, whether it's on a very small, individualistic scale, but it has been produced in the Caribbean now. So in terms of the language of we are not large-scale producers, we are not producers, 3D printing has changed that in terms of decentralizing production. Also, the emergence of ghost guns, including ones sold in kits, are not traceable because the parts lack serial numbers. And that have a great implication for detection and for forensic ballistic. More importantly, I would say the issue of firearms conversion devices, whereby weapons are converted to fully automatic. So you may hear about a Glock and you may hear about a Glock switch, whereby it's a conversion devices, and some of those conversion devices you could see on the slide. You could see this one for $14.99 US. Imagine turning a weapon into a fully automatic. And you could bypass some of the laws in the region. So for instance, most of our firearms law prohibits certain types of weapon, or let's say fully automatic or semi-automatic weapons. So most of our laws prohibit fully automatic weapon. By buying those conversion devices, you're changing your weapon now to a fully automatic weapon. Now, interviews undertaken with prison inmates in Belize, Suriname, and Trinidad and Tobago shed further light on the illicit acquisition of firearms in the Caribbean. Firstly, it is documented, the data is there. Most of the weapons that find themselves in the Caribbean come from the United States of America. For some countries, up to 90% and more. But in most countries, 70% and more of those weapons come from the United States of America. So inmates who committed firearms offenses acquired their firearms at very young ages. More than half acquired their first firearms under the age of 19. They also had very low educational attainment, including a high rate of dropping out of school. When asked about the reasons for acquiring an illicit firearms, many inmates indicated self-protection as well as family and peers as being important drivers of firearm possession. Others indicated that the environment they live in, including the existence of local criminality in their neighborhood, structural issues in their communities, or difficult living conditions linked to poverty, which we all know as social deprivation, were also some of the reasons in which they acquired weapons. Now, I just want to note also, it should be noted that CARICOM gun laws and regulations are highly restrictive by global standards. The key issue we have in the Caribbean is mainly that of illicit weapons. In most of Latin America and Europe, by comparison, a typical gun license allows the owner to legally own several weapons. In fact, in the Caribbean, basically, you'd own just a single weapon. And we have an average of 1.63 registered firearms per 100 residents, which is quite low compared to other global indicators. And throughout much of the Caribbean, only specific kinds of firearms can be registered. Now, the big picture masks significant differences across CARICOM member states. So most times when we look at the region, yes, we must look at the region as a whole, but that big picture in a simplistic manner could mask the differences in different countries. There are important differences in terms of the structure and operation of gangs within CARICOM. Take, for instance, some are local gangs. In some countries, you have mainly local gangs, although they may have significant presence and be responsible for the majority of the crimes in certain areas in member states. There are also many states with sophisticated criminal gangs with presence in more than one state. Now, interestingly, a key UN Security Council resolution was UN Security Council Resolution 2633, 53, which looked at Haiti. Most times when the UN Security Council deliberate, they look at issues such as disarmament issues and arms control, which mainly look at perhaps nuclear weapons, chemical weapons, and those other issues. UN Security Council Resolution 2653 was first acknowledged that criminal actors and activities could themselves be direct threat to peace and security. So that was a departure from what the UN Security Council usually look at. And given the situation in Haiti, they noted that criminal activities, that resolution noted that criminal activities could have a huge impact in terms of international peace and security. Now, I would also like to note, especially looking at Haiti and looking at the public health implication of violence in Haiti, that many hospitals also and clinics have been vandalized and looted, including the State University Hospital of Haiti. And citizens and patients have been impacted by lack of access and medical, pharmaceutical, and laboratory service because of the critical issue they have in Haiti. And the kind of psychological trauma for public health workers working through this violence. So most times we think of violence, but we do not look at the impact of that violence on public health workers. And Professor Ivor Griffith noted the declaration, the last declaration, and the last declaration took into consideration issues of, I would say, the psychological issues and the impact of those psychological issues on people. Our vision at Impacts is for the Caribbean to be the safest place to live, work, and visit, where people thrive. Now, noting that vision, how do we advance that vision? In terms of the region's agenda, and as noted by Professor Ivor Griffith, we have seen a paradigm shift in terms of how crime is viewed. And how crime is viewed, that lens now has shifted to more a public health approach. And we have been given a public health approach mandate within CARICOM to advance our agenda in terms of reducing criminality in the region. This commences from a meeting of heads of government, where a declaration on crime and violence in Trinidad and Tobago in 2023. Then I would like to jump to the George Bridge Declaration in November last year. But importantly, I think a critical instrument which was advanced in 2023 was also the Needham's Point Declaration on Criminal Justice Reform. And I know that Ivor Griffith read the definition that was proposed last year in terms of what is a public health approach for us in the Caribbean. What does it mean? So what is a public health approach? What does it mean when you hear this word be banter around? What a public health approach does is that it allows for a comprehensive, evidence-based, and preventative strategy to address the root causes of violence and criminal behavior. It shifts the focus from purely punitive measures to prevention, early intervention, and rehabilitation. Previously, all what you'd have heard was a war on drugs, a war on this, a war on that, incarceration. So the public health approach is shifting that focus from that punitive measure. Why a public approach? Crime public health issue, it linked to addresses the root causes, whether it's poverty, unemployment, education, and social inequalities. And anyone who would have done criminology, whether you did criminology in the 1950s, 1940s, and you do criminology now, you get those as some of the root causes: poverty, unemployment, education, and social inequalities.
Alexis, see if you can wrap up in a minute or so.
I will. It also targets youth and gender-based violence, mentorship, skills training, and survival support. And Professor Ivor Griffith also notes the definition of a public health approach. We also must recognize that within that public health approach, that we too can't do it on our own. And heads of government of the Caribbean have lobbied merit to policy prescription changes and changes. Due to time constraint, I won't go through this. The status of those, we don't know, because there have been political change in America. But to finalize my presentation and to complete, this shift of a public health approach means that we must denormalize violence in the region, and we must change the environment in which crime operates. I thank you for giving me the opportunity, and I thank you for your listening ear. Thank you, everyone.
Wonderful, Calixtus, as usual. Thank you very much for that. I think, ladies and gentlemen, it's clear that based upon what we heard from Calixtus, we're dealing with a challenge, with a phenomenon that is multidimensional, it's transnational, but it's also, particularly because of what the public health approach embraces, it's not amenable to a quick fix. This is a long-term journey on which we are engaged. Let's turn attention now to Dr. Edwards. The floor is yours, Elizabeth. Ready when you are, Elizabeth.
Hi, morning everybody, and it really is a pleasure to be here and to be part of this important presentation for the consortium and with all the experts that are dealing with the issue. I'm an epidemiologist. I deal in data and got involved with crime and violence just because we saw, as you just heard, that there is a tremendous impact. This is a picture of a gunshot wound being rushed into KPH with all of the medical staffing and all of the audience that is watching this patient being rolled in. What we had at that time was a vision where 38,000 patients were coming into our Jamaican hospitals. And 1 in 4 of our operations at the major public hospitals were being canceled because of violence-related injuries and their impact on the hospital, as you heard, unbelievable. So as an epidemiologist, we ask 3 questions: who, where, why, what, and when. And we set up the Jamaica Injury Surveillance System and had many partners to help us. But what it did was answer the questions on what were the circumstances, what was a victim-perpetrator relationship, the place of occurrence, the method of injury. In other words, was it a gunshot wound or a stab wound or a push and shove, and whether alcohol and drugs were involved. The area that we used a lot to link back with the community and to link back with security was the place of occurrence. So we took that data, and this is the kind of mapping that we got, even from the early days, of where the cases were coming from. And we got violence-related hotspots, which we then were able to overlay with many other types of data to try and see what are the options that are available to address this. So this looks at downtown Kingston, and in particular an area called West Kingston, where you would have the most intense red activities. The other thing that was done shortly after that was to take all the crime and violence, gun-related and stab wound data from the police and then overlay it with the hospital-related injuries. So all the red dots are the homicides from the police, and all the blue dots were the violence-related injuries from the hospital KPH. We didn't have 2 other hospitals, which is one in Spanish Town and University in this data set, but we can see this picture got the security forces very interested in working with us to use this hospital data to guide our public health interventions. Many of our esteemed criminologists, including Professor Harriot, when he looked at these maps, he pointed out, and we actually collected data to show that a majority of the proportion of violence-related injuries in these hotspots were due to reprisals. So when we talk to the victims, that came into the hospital. This is Jamaican patois, but this is a stab victim. You see how me come for take me stitches, she has to take hers back too. So the stab wound victim is saying he had to come to hospital and get stitches. He is going home to stab his female partner, so she has to come to the hospital and get stitches. Another stab wound, me must get him back. I must get the person that stabbed me. And even more on a gunshot wound. As I go home, I go for my gun, somebody have to get shot. So we're seeing where there is this continued issue of rehabilitation and reprisals that are planned from within the hospital that can be addressed. We looked at the cost. You heard from the study that we did with impacts and small arms survey, and we had done a cost of care study. This is one case of a chop wound in a fight in a 24-year-old male. The cost for saving his life was $76,000 US. And that money, is not recoverable. So as you heard, we looked at the direct medical cost, and we looked at the indirect medical cost of this 25,000 cases of violence-related injuries. Very detailed data collection, and we saw how huge the bill is and how much waste and loss of life and displacement in the society is caused. And one of the things that was very interesting was we were looking at admissions at KPH running about 14% from gunshot wounds and stab wounds. But what we knew is if half of those gunshots and stab wounds were blunt injuries, admissions would drop down to like 10%. And if all of the gunshot wounds and stab wounds were prevented, we would have, less than 8% of our hospital time being and resources being used up. So one of the things, though, is how do we share this data effectively with other areas of persons who are, and I'm going to just play part of an interview that shows what outreach workers can do and need to be doing across the Caribbean to really reduce the scourge of violence.
Gun violence has destroyed many lives.
Sections of Trenchtown in St. Andrew remain tense after a man was shot and killed in the Havana.
It was a bloody night in Trenchtown last night. 2 people are dead following
killing of a teen and the injuring of another man on 3rd Street in Trenchtown, St. Andrew last evening has sparked calls for tough measures from the security forces.
But our reporter Nick Davis has been finding out about a project that's helping to reduce gun violence there. Hi, Nick.
Hi, Myra. Yeah, I've been in Jamaica for, 18 years. And in that time, the focus on gun violence has come largely from crime and justice point of view, tough on punishment, and almost an eye for an eye kind of mentality. Now, it's young men who are from inner city communities that are the ones that are at risk. But I've been finding out about the work of the Violence Prevention Alliance Jamaica, which sees gun crime more as a public health issue. That means addressing the underlying causes as you would any other disease and treating them. In this case, with targeted educational and social programs.
Right, Nick. I mean, that's interesting, but how does it work exactly?
Well, Myra, they use the data about the where and when and how of gun crime. They don't get it from the police, though. In fact, they get it from hospitals. What they found is that the hospitals know more about the instances of gun violence than the police do, and that's because of where people who get shot go to get treated. Whereas they don't always want to go and report it to the police for fear of retaliation, they will end up going for treatment. Figures have even shown that police know only about a quarter of the number of incidents that actually occur.
So, Nick, hospitals have this information and that's helping to get the data. But what happens after they've collected the data?
That's right. That's where the community really do get involved in this. I drove downtown to the Restorative Justice Centre in Trenchtown, West Kingston, a place famous for musicians like Bob Marley. And that's where I met Sonia White, a community leader. Now, Sonia introduced herself to me as a proud citizen of Trenchtown. To be fair, that's really a bit of an understatement. She totally lit up as she described the camaraderie of her community. But she explained to me how gun violence had changed her life dramatically.
Past 23 years, I lost a nephew. I was also a victim of intimidatory gun tactics, and it has led me into community work. Because when once I was so aggravated and vexed and vengeful and everything, I've learned to forgive. And that led me to become a mediator to help to deal with conflict and work for many years with at-risk youth. And from where I sit, I know many a persons or many a youth who somewhere along the line have gotten derailed, but they're still good in them.
To be clear, Sonia's role is purely as someone who has the trust of the people and knows her community. What made it really clear that she didn't want to be seen as an informer or anything like that. She attends regular meetings run by an organisation called the Violence Prevention Alliance Jamaica. It brings together educators, police, social workers, the church, all sorts of people, and together they map out where the hotspots, where the violence is really coming from, using that hospital data and other information. Community leaders like Sonia then advise them what educational or social programs, such as apprenticeships or after-school activities, or even psychological counselling, will work best in what area.
So you'll just look and see any repetitive behavior, or so to speak, like on 5th Street, if at 12 noon 2 weeks ago a crime was committed, you map it. So if it is repetitive and based on the time of the day and all of that, you'll do and say when and where we can have some intervention going on. So take control of the minds of the youth at a particular time of day when they will try to harm themselves or harm someone else. Then you build workshop around that timing, and with the data gather, then the police can better police the area, patrolling, so it helps to prevent further crimes from happening.
The organisation,
Okay, I think we can
20 years ago.
Stop right here and go back to just wrapping up the presentation. So I think what I was showing is, while I bring up the current slide, is the work and the potential of work of sharing the data and having the right people as trusted messengers like Sonia, and working in a collaborative way with all the agencies to make a difference. And what we're now looking at is doing that kind of work and even dissecting it more and realizing that if we go back to the current data on West Kingston now, that we still seeing the same, unfortunately seeing mainly the same areas affected despite many security interventions. Not much public health work was being supported. During the time we got the funding and had the workers there, we saw up to a 45% reduction over a 5-year period in this area. But when the work stops and the support is not there to prevent further incidents, we see it ballooning back. But we saw something very interesting, that the murders and shooting are concentrated in 5 to 11% of the nation's street segments. And half of these, again, were even in 1 to 3%. And it really shows you that understanding issues of place and environment really can guide us in how we respond effectively and reduce over time. So I think from our perspective really is that our males are an issue. We need to have these young people who are high risk getting things like CBT and being part of after-school programs. We need trauma-based programs. Too many of our young people or health staff and that are really traumatized, and it leads to all kind of problems that we were hearing about. And we need the data sharing at the hospital, and we need linkages with the outreach workers to work with communities and to be guided by data. We're not the only country, and many countries across the world are doing it. The Cardiff model is definitely one that in Wales, where they showed that sharing the data from the hospital with the security and other agencies saw a sustained reduction in that. But like what we heard earlier, what we have not done in the Caribbean and not done in Jamaica is actually get that data sharing ability to be in law. And I think the reason why the Cardiff model has been so well supported and maintained is because it was actually put into law and funded, and now is even across the United States. They are using the Injury Prevention Partnership to reduce gun violence and reduce the impact on the hospitals and the citizens. So I'd say to you that as I am working forward to hand over to the other experts, that we really need a better way of working together. Public health is very important, but we have to be able to work effectively with education, with transport, with foreign affairs, with law enforcement, and with the church and social services. And when we do it, and when we do it well, where we see the longest benefits and impact is portrayed in this community mural in Kingston, where we actually see people getting together and moving from the fact that they're burning down houses and shooting to working with the police, having dances and burning the guns, and that they're all together happy playing in safe, clean, green community spaces. And I think this is where we want to go, and our partnerships are very important. And I think data and using the data effectively and our knowledge of historical and social knowledge to guide us will make us become the place to live and to share and to enjoy the Caribbean. Thank you.
Wonderful. Thank you, Elizabeth. And again, multidimensional, again, not amenable to quick fix. But I want to connect something that Mr. Joseph said that resonated with something that Dr. Ward said. Mr. Joseph talked about the 2023 first symposium in Trinidad and Tobago. An element of which was highlighting the cost. And we heard from Dr. Ward some of the costs involved in the Jamaican context. I want to share 2 sentences from that 2023 speech by the Prime Minister of Trinidad at the symposium of what it costs Trinidad and Tobago. Here is what he said in his speech. For a surgical intervention to the head costs approximately 170,000 Trinidad dollars, one intervention. A surgical intervention for a chest wound would cost 135,000 Trinidad dollars, one intervention. A shot to the leg requiring surgical intervention would cost just under $100,000. And a leg shot without surgical intervention would cost about $40,000 in medical care and attention. So the implications go beyond simply the law enforcement. They go to the public health, they go significantly to the economic dimension, the cost. And invariably, when we hear about crime and violence in the Caribbean, the tendency is to spotlight where the media takes us, happens in Haiti, what happens in Trinidad and Tobago. But for the last 4 or 5 years, there's been an upsurge in crime and violence in some of the smaller jurisdictions in the Caribbean, in the Eastern Caribbean, including St. Vincent, including St. Lucia, including St. Kitts Nevis. And I'm delighted now that we're able to have from St. Kitts Nevis someone who will share us some of the dynamics, the trials, the opportunities of managing the public health aspect of crime and violence in his jurisdiction. Allow me to invite Mr. Hans Richard.
Good morning, everyone. I'm just making sure that I have pretty good audio. Is it okay, my audio?
Doing good, doing well.
Okay. So allow me
Sounds
also
good.
to give much thanks to the Florida International University, Latin America and Caribbean Center for inviting me along with the Caribbean Policy Consortium, inviting me to present my task, which is to inform not only about crime and violence as a public health issue, but in reality, in St. Kitts, we have started the groundwork where that is concerned. However, I would like for everyone, whether you're a doctor, whether you're a lawyer, medical practitioner, I would like for us to just sit down for a moment and think about what is our role, what is our responsibility as it relates to the impact of gun violence in our communities. The Caribbean, as we know it, is celebrated for its beauty and vibrant culture. However, we are currently, every country in the Caribbean, grappling with a significant issue, is crime and violence. Annually, as we have seen from the other two previous panelists, over 4,000 individuals lose their life to gun violence annually. And we have more, over thousands who are dealing with non-fatal gunshot wounds. In terms of currency and finances, we recognize government spends over $10 million annually. This alarming trend threatens the future of our generation, our youth, and we have lost in some cases one generation and about to lose another if we don't take this immediate and important step of looking at crime and violence from a public health point of view. Crime and violence affect both adults and children, and it makes it a very complex biosocial disease that demands immediate response. So let's look at the colorful Caribbean that we live in. Guns has now become a contentious issue, and one of the problems that I'm seeing that we continue to experience in the Caribbean is a political issue. Today is one party, 5 years later there's another government, and government establish policies. For example, we're now looking at crime and violence as a public health issue. Maybe there's a change in government, and the new government does not think that that's the correct way to go, and we go back to the punitive actions of law enforcement and the law. And so it has become a very contentious issue, nasty and polarized. For example, typically in St. Kitts, when the Prime Minister mentioned that we will look at crime and violence from a public health point of view, they were like, what are you talking about? How could you look at crime and violence as if it's an infectious disease? There's no linkage. Let's just go and arrest everybody and throw them in prison, lock them up, and forget this crime and violent public health issue story. And also recognize that it is everyone now is trying to get licensed firearm, because everyone now realize that the dangers of the gang violence, it's now spreading and it could get to their homes. So everyone wish now that I need my gun rights. I should have my own personal firearm. And finally, recognize that there are very little and few viable solutions to crime and violence, which takes us into what we are used to. We are accustomed of, and it was very well expounded on by our first panelist, the police officer, law enforcement, the law, punitive action, and we no longer have any trust in law enforcement in most jurisdictions, in most countries. Persons are afraid to go to the police officers. They are afraid of reprisal. They're afraid of being called snitches, and as we know in local parlance, snitches get stitches. And so the police, the function of the police now has become so difficult for them to function. So persons are no longer going to the government police to give them information. Rather, they prefer tit for tat, like was mentioned by the former panelists. And what happens in all of our some of the jurisdictions in recent time, Trinidad and Tobago, Jamaica, and I think in St. Kitts 2017-18, when the glass is broken, then we go to the most convenient method, which we have state of emergency, when we no longer have any solution, and it would have escalated to the boiling point, to the breaking glass, and we call state of emergency. So in 2023, a paradigm shift came into existence from the Caribbean country, and everyone else has spoke about it. And Dr. Williams from St. Kitts and Nevis, Isabel Williams, would have spoken seriously and intensely about the immediate need to look at crime and violence no longer from a law enforcement point of view, but from a medical point of view, such as public health point of view, and look at it specifically as an infectious disease, because it takes the same trend as an infectious disease, a cluster-like infectious disease. So you see, we have crime and violence today, we have 2 murders, and then everything slows down, and then it goes back into a wave. We have 5, 6, 10, 20. Again, we go into a lull. So we recognize that the trend of violence and the trend of infectious disease is similar, it's the same. Violence transmits through exposure, modeling, social learning, and norms, same way as an infectious disease. And so when I was tasked by the Prime Minister to lead the group in finding out what are the root causes, what barriers are stopping the solution, or what solutions we can use in St. Kitts and Nevis to prevent crime and violence, in many of the conversation that we would have had with the public, they would ask, well, what can you explain? So during my explanation, during my sensitization times on social media, I was asked, like, what is it? What is crime and violence? What is it? Explain properly as a public health issue. And so I went back to the most frequent infectious disease that we would have experienced, which was COVID-19, and I brought it to their attention. What was responsible for carrying the virus? What was responsible for getting the virus? How was it transmitted? How did the transmission cause us to change our social norm, change our behavior, and prevent spread? And so I explained to them what the agents were, what the hosts were, how we deal with interrupting transmission. And so we focus in citizen security, we focus on 3 major aspects in our fight against crime and violence from a public health point of view in St. Kitts and Nevis. Thanks to Dr. Gary Sutkin, who I would have read about extensively and gathered lots of information from him about how in Chicago and other United States states would have dealt with crime and violence as a public health issue. And one of the ways he looked at at dealing with crime and violence was through interruption of the transmission. And like the former panelists made mention of what they're doing in Jamaica, it's somewhat similar. So once there's a crime, the interrupters will go and mitigate any further issues. While at the hospital, we utilize what you call teachable moment for the nurses and the doctors, the bedside, so to communicate with the persons who are suffering non-fatal gunshot wound, to find out what is the reason and try to mentally prepare them or mentally communicate with them so that they would not go and when they leave the hospital would have no need to retaliate against any other individuals. And so the Prime Minister decided that we should have a 90-day campaign, 3 months, to look at how we could find out the root causes. And the good thing about it is we recognize in the Caribbean that we are very dimensional. And so with the ability that I have to speak multiple languages, I was able to even reach out to the Spanish community and find out what they think were the root causes, what they think were the solution, and what barriers could prevent the solutions from being effective. And in every community, so we looked at parishes and we also looked at Nevis. And when we look at the data that it produced, the sex, male and female, there was equal distribution between male and female who attended these community engagements. And one of the outstanding reasons for crime and violence in St. Kitts was issue of family. The community thought that the community needed to do more for the family themselves needed to do more. We needed more programs, we needed more policies, we needed more financing when it comes to family, anything that deals with improving and strengthening the family. Then we look at the other problem was job opportunity. And as we speak, we are going into the beyond 90 days and we're looking at job opportunities, better way forward. So we are putting a program together for job opportunities. So persons who were at risk, who are at risk, persons who are even incarcerated, there are now programs where they can be reincorporated into the community and giving them opportunities, job opportunities. And suffice to say, the Prime Minister would have also invest heavily in mental health specialists, and because we recognize in Nevis specifically, one of the issue was peer pressure. And so we are now also looking at mitigating that issue, not just with the youth, persons who are being shot, co-victims, and prisoners who are even persons who are incarcerated, who are leaving their rehabilitation program. They are given situational awareness sessions to look and to try and find out how successful the programs would be and how ready the persons would be to be reincorporated into society. In terms of the solutions, and for me, this was the most interesting part of the investigation and the community engagement, where we look at it's very easy for us to point our fingers at the government and say it's the governments are responsible for ABC. But if we look at the chart in front of us, we recognize that the government has one of the lowest percentage in terms of solution to the problem of crime and violence. The major problem of crime and violence comes from the community, which means that our focus now, crime and violence, has to be community-based. We must focus on community, establish funding, establish groups, establish secretariat so that we can put as much emphasis in communities as is possible. We look at police. We have 15% of the responsibilities placed on law enforcement. And so we recognize also, and thus obviously the results from the police only base when it comes to crime and violence, the engagement show exactly what it's all about, that we cannot no longer depend solely on the use of law enforcement. We have to focus more on the aspect of the community in assistance with government and other NGOs. So in conclusion, we recognize that a multi-sectorial approach is critical to dealing with the crime and violence aspect from a public health point of view. Key priorities include strengthening, promoting economic stability, enhancing the communities, and definitely more funding. Funding is important. Prevention is also critical. The recommendations are holistic family approach programs, including parenting education and youth mentorship. We're also looking at established economic initiatives, job creation, vocational training, and small business funding. Mental health services, like I said, the government would have established lots of finances when it comes to as it relates to the mental health aspect of the approach of crime and violence from a public health point of view, community engagement mentorship programs, after school programs, sports club programs, educational reforms, conflict resolution, and life skills in school. And one of the other big speaking points in the Federation is what we call, we need to improve on the way in which persons deal with conflict from even a primary school point of view. So they're now creating programs in St. Kitts where we learn to teach children to mitigate problems from a very, very early stage in their school lives. Finally, I encourage all of us as we leave today with this session to assure us that as every healthcare provider, practitioner, or medical doctor, EMT, psychologist, pharmacist, that we have a very, very, very important role, that we possess the ability to change the conversation, to change the scope of how we look at crime and violence. And together, we all have the ability to make the Caribbean safest and most viable region in the world. Thank you very much, and I await your question.
Thank you very much. Thank you very much. Another wonderful, excellent presentation. But I think, like the other presentations, Mr. Ridges' intervention reveals the reality that this is a multidimensional phenomenon you're dealing with. This is not a phenomenon amenable to a quick fix. And in the context of getting the most out of this webinar, it's always valuable to have a question and answer segment. And I'd like to now invite anyone who is interested in posing a question or offering a brief comment, use the Q&A feature of the webinar to be able to get that component going. But I want to maybe start the questions ball rolling by asking each of the three panelists to focus on one critical area. Mindful that this is a phenomenon, an approach not amenable to a quick fix. Mindful that it's a costly enterprise. Talk a little bit about the funding opportunities and challenges. Where are we likely to get, where have we been getting the funding for this approach? What are the challenges you envisage now, and maybe even beyond now, given what are some of the new dispensation approaches in parts of the global north, but funding? Let's start with Calixtus, and then ask Elizabeth, and followed by Hans, to talk a little bit about the funding aspect.
Thank you very much for this question, Dr. Griffith. I think we spoke to the issue of a paradigm shift in terms of how we view crime. Given the new dispensation, there must be a paradigm shift in terms of resource mobilization in this region also. Whilst Caribbean countries and Caribbean government have, to a great extent and to a large extent, have put their monies in terms of what they have uttered. And it is not just platitude, they have actually put a lot of resources in crime. If we look at the budgets of most countries in the Caribbean, we would note that this budget for security have been increasing for a number of years. Notwithstanding that, more will have to be done by us within the Caribbean. We will also need to partner, and we spoke about the issue of multidimensional, multisectoral. There will need to be more partnership with the private sector also. But what I'm stating also is that Caribbean government now will have to do much more than they have done. But notwithstanding that, they have done a lot in terms of resources put into the issue of crime and security. Thank you for this.
Good. Elizabeth?
Yeah, I think we are going to be faced by further challenges. Issues of progress that we made on gun control are likely not to be sustained. Funding has already been cut, not in many of the islands that were looking at using some of this community violence interventions and outreach workers. The programs have stopped in St. Lucia, for example. And so what I think we're going to have to do is ask the governments, first of all, to really look at the data to, just states of emergencies, which are very expensive. But if we could use the data to be more look at the issues of focused deterrence and violence interruption, and invest in those activities, I think we can find a balance and we can find resources within most of our existing budgets. And once you get success breeds more investment. And I think that what we make, anyway, so the data is critical and focused in while you're waiting on that. Oh, he's
Go ahead, Elizabeth.
I
Are you done? Are you
apologize. So,
finished?
from our St. Kitts and Nevis point of view, the challenges, just like everybody else, would be financially. However, the Prime Minister would have made it he would have given us his word on finding any means necessary to provide the funding. He also made mention of contacting and seeking funding from PAHO and CAFA, because we recognize that we are now looking at crime and violence as public health issue. And so those are the entities and the organizations from a Caribbean point of view and regional point of view that are responsible for dealing with crime and violence. On public health. We also would have lost funding from USAID, as we recognize that funding are now being reduced to very little to none. So we are now also seeking funding from the UAE. If I'm not mistaken, that's what he made mention in the last meeting we had on Thursday. Also, locally, what we're gaining funding, like Dr. Ward would have mentioned, from the NGOs, are now recognizing that because they have been actually for the past 2 months there have been no crime and no homicide as it relates to gang violence since the program would have started, and NGOs are now coming on board and giving their contribution financially, and also opening the doors to employment of persons who would have been incarcerated and reintroducing the public. And so even though we are facing a financial crisis or financial funding issues, the NGOs, the local NGOs, and we also working in collaboration with the Chamber of Industry and Commerce, who is the one who is responsible for assisting us with finding job opportunities for those who are entering into the communities and the environment. And it was so far the relationship has been going pretty well in terms of with commerce, the other NGOs, and the community citizen security, who's responsible for looking at crime and violence from public health point of view.
Wonderful. Thank you, Hans. I want to thank Mr. Mauricio Chase from Barbados for this question, and it's directed to you, Calixtus, and I'll read it in its entirety. Given the rising concern over 3D printed firearms in the Caribbean, is CARICOM impacts engaging member states to develop harmonized policies or regional legislative frameworks to regulate and curb their illicit production? Also, what policy or technology solutions do you consider most effective to address the emerging security threat of 3D printing?
Thank you very much. 3D printing as a new and emerging trend, not just the Caribbean, but globally. In terms of what CARICOM impacts have been doing that, we have basically sensitized all member states with regard to this threat of 3D printing. Not just sensitize member states, but we have had very good, I would say, conversations with customs officials. And the reason I mentioned customs officials, because most of the 3D printers will come through customs. We are looking at different measures in terms of implementing to reduce the issue of 3D printers being used in terms of nefarious activities. Firstly, we must know that 3D printers are dual-use goods. So there are a lot of good to be done with 3D printers. For instance, just last year, I was thinking, okay, what's the best gift to buy for my daughter in terms of technology? And I was thinking, okay, if 3D printers is at a reasonable cost, perhaps that's a good gift to buy for her. So in terms of large-scale manufacturing 3D printing, we could even think about houses being built. So notwithstanding that it's a dual-use good, and perhaps prohibition would not be perhaps the right policy. Prohibiting 3D is not the right policy. What could you put in place? Firstly, you would want an indication of everyone that have a 3D printer, anyone that's coming with a 3D printer in the Caribbean. So that's the first thing. So a listing of that would be critical for law enforcement officials. So they would know basically if Mr. A has a printer or if Mr. B has a printer, and who likely have a greater risk of using a 3D printer for nefarious activity, let's say to produce a weapon. So that's one way I think some countries are looking at it. Also, within 3D printers, there is technology where you could perhaps imprint within the printer that it cannot produce a weapon. So some states are looking at that. So it's not having legislation for 3D printers is a challenge also. Globally, it's a challenge. But how could we prevent 3D printers from producing weapons? So maybe governments could even lobby with manufacturers in terms of using GPS. If the 3D printer is within the region, that it will locate, it would have that GPS location, and then any attempt of printing a weapon, the 3D printer will not do that. So technology could do that also. So those are some of the solutions, but it's a solution that is being looked at globally, not just in the Caribbean. That issue is a global issue in terms of technology. Have I answered all? I think yes, on the policy side and on 3D printers. Yes, I think I've answered the question. Is there anything else within the question I did not answer?
I think you did a good job. Thank you, Alexis. Let me turn to a question from Mr. Norman Livingston Kerr. Not sure what jurisdiction he is in. And it's a question that goes more to Dr. Ward and Mr. Richards. I need to read the context of the question. And here it is. I'm hearing a lot of information on kids in schools, the root causes of violence and distress in prevention. I understand that. But what are the efforts to work directly and in a sustained way with those kids involved? This is the group that is in what's work being done with the kids, particularly kids in schools. Elizabeth, and then Hans.
Yeah. The Ministry of Education is fully on board, and actually the government has set up what is called a Citizen Security Secretariat and an overall citizen security plan, which has 10 government agencies working together. So they recently looked at a 25 school strategy, which looked at all the schools in the zones of special operation where the highest level of crime and violence is occurring. So those schools would be where the children who are most affected. So we're already using the data to focus our attention to the greatest need within the educational population. But even within that, there's a framework that looks at a tiered system of identifying within each school a subgroup that is, showing deviant conduct disorders and doing specific interventions. Like I was talking about specific after-school programs, involving them in after-school programs, and then even direct therapy like cognitive behavior therapy, and also following them up over time to make sure that these interventions work. It's wide, the need is huge because of the level of violence, and we have to continue and make sure that the dose of the intervention is really enough to cure, since we're talking kind of infectious disease, to cure or to mitigate or to provide the wraparound services of family, friends, to help those young people see that there are alternative ways. There are alternative ways to make money. They don't have to get involved in gang activities and other illicit activities for them to find a way to become useful Caribbean citizens. So it's a lot of work, but the data and focusing and using the evidence of what works and what doesn't work is guiding us in the way forward.
From my end, we recognize that public health scope for criminal violence is about endurance. 5,000 meters, 10,000 meters. It's going to take time. Like I always say that during
you.
my
Thank you.
engagement, I always say during my engagement, it's going to take time, have patience. Just like we had patience during COVID, and norms will change and behaviors will change, you need time. In reference to the children, we are looking at a research now in St. Kitts where we are targeting the schools in the at-risk areas as the focus group, and we're comparing it with those in the non-risk areas, and we're focusing on deviancy. For example, so we have over a period of 3 months, we're going to look at some boys, girls of grade 1 to grade 3, if I'm not mistaken, over a period of time, and find out each time we would collect the data on the behavior, whatever the deviance is, we will collect that data, and then we will go and find out the reasons behind the deviance, whether it was parenting, whether it's lack of breakfast, whether it's lack of lunch, whether nowhere to sleep, no rest. Coupled with the assistance from the Ministry of Education and Ministry of Sports, in the afternoon, there are programs that are formulated specifically for those deviant children, because we recognize now that specifically in St. Kitts, most of the fights that we're having in schools are among women or girls rather than boys. And so we're now looking at both sexes and how we can remove them from that deviance. Just like Dr. Ward would have said in St. Kitts, for citizen security, every ministry in the government of St. Kitts and Nevis is involved. We meet every second Thursday, and a representative from the ministry, be it the PS or the direct minister, is part of the meeting. And so they will present their programs that they have that are geared towards interrupting transmission, changing norm, and reducing spread. And so each time we meet, we share information and we go back into the communities. And so yeah, that's what we're doing in schools, improving on the programs that work, removing those that were not viable and not working, and focusing specifically on the children in primary school so that we start changing their norm and their focus on how they see life, especially those within the deviant and the violent community. Because you have children in grade 1, grade 2 already susceptible to smoking, gang violence. Some of them are victims. And so we're trying our best to find out what is causing these deviant behaviors and how we can best mitigate them. And we are also making sure that we take their parents and put their parents through programs so that their parents can understand if they're not working, the government is also assisting in finding work for them at this time. So it's an holistic approach. It's a very, very, very strong community-based approach. But again, it takes time. Because again, we would have lost generation, which is 30 years. And so it's going to take time for persons to understand. And one of the things that one of the ways the Dr. Elizabeth was speaking about dosage, after the first 3 to 6 months of the program, we're going to go through what you call a steady state situation, just like in medicine, taking medicine. And that steady state period would be to evaluate the way forward of the program, if the programs are working, and what changes need to be made within these programs. But we are hoping that we do not stay too long so that the dosage we need to put back in the dose, so we change make the changes that need to be made or continue with what we have. So we're looking at the endurance from a steady state point of view.
You have to have a booster to the dose.
Yes, sir, pretty much.
Mm-hmm. All right, thank you very much, Mr. Richards. We're approaching closeout time, and I'd like to do the following. I'd like to invite each of the panelists to take 1 minute to offer some final thoughts, and then I want to turn it back over to Dr. Pereira, with thanks to all the participants, all the people who were online, to Claudia and the technical team for this successful event. So we'll start with Mr. Joseph, go to Dr. Ward, Mr. Richards, final thoughts, 1 minute, and then over to you, Tony.
Thank you so much, Dr. Griffith, and thanks for allowing me to be present here today and share my views on crime in the region. In terms of my final thought, I would first address for 20 seconds a question in the chat. I do not want the participant to say that the question was not addressed. The question is about whether we should fund more government services more than NGO. The answer to that is no. I think too often we speak to issues of crime as a dichotomy or as in a way polarizing the issue of crime, whether we should fund law enforcement more or NGO more. The issue is that both need funding. That's my answer to this. Both need as much funding and resources as possible. So it's not about defunding anyone. We are also pleased in the region that government has taken a new shift and a new look at how we approach crime and criminality. For too long, from researchers, from the evidence, have been stating that we should look at it from I would say, a public health approach. There are many other words we could use, whether we use evidence-based approach and other approaches, but let's say a public health approach. I believe this is a welcome view in terms of looking at crime and security, and it's a welcome view in terms of that it adds more in terms of managing the problem. Add more NGOs, add more civil society, more researchers. The more of us that come together, the better in terms of looking at and managing the problem. Thank you very much.
Great. Elizabeth, final thoughts?
I think we need to make sure that we understand it's a partnership. It has many actors, but in particular, the public health approach has to work closely with the security approach. It can't be one against the other. And we have to look at funding both, funding and ensuring that we are funding effective programs. A lot of work has been done on looking at which programs really work for what and what kind of problem, and we need to ensure that we are providing that. But security and public health have to work together. And when we share the data and we work and we see the effectiveness of both things working together, we then realize that we're going on the right track for the long term.
Yes, in closing, for me, teamwork make the dream work, and it won't be I think it's not a St. Kitts and Nevis issue, it's not a Jamaica issue, it's a Caribbean issue. And so, in closing, I would like us to know that we have to work as a team. We data sharing. If something is working very well in St. Kitts, how can we utilize it in St. Lucia or St. Vincent? But and make adjustments where necessary in order for it to function. So for me, the success has to come from the organization, the government, and the researchers as a team. Because once if you recognize the criminals work as a team, so we now have to work as a team. So we have to establish that sharing and receiving, and not be afraid to request assistance where necessary in order to get across the line. But again, it's going to take time. It needs endurance because it's over 30 years. We have lost generations, so we have to put in a lot of effort to be able to reduce the crime and violence from a public health point of view. And like I said I always say in St. Kitts, it's going to happen, just going to take time.
Wonderful. Over to you, Tony.
Yes, thank you, Ivalo. Thank you for wonderful moderation. Thank you for the three panelists. I welcome this approach. I think the public health dimension has been neglected, and it's great that you're embracing it. I would encourage you too to promote case studies of particular communities, maybe a particular town, a region, a country, where you can say the public health dimension has been added and has contributed to these results. Because I think when people can point to a map and say, we know that this has worked here, it inspires confidence, and I think it fires people's imaginations, to make it concrete. And we can help you do that in LACC, because you may have a case study in the pipeline that we can produce as a policy paper. We have a new policy paper series that could highlight an instance of success, because I think people often want that kind of narrative, that illustration of something where it's worked, because there'll be skepticism. People say, well, you've just got to lock everybody up. You just need to have conventional draconian public security policies. That's what's going to work. And I think your approach is much more, it embraces the complexity. It's much more promising. But a case study, a really concrete case study would be great. So I'm open to receiving a draft policy paper from any of you on that we can highlight on our webpage. Thank you. Ivalo, do you want to say something about the next CPC webinar?
Well, thanks everyone, and thanks to the participants online. No, except that it's going to be looking at United States Caribbean relations in the context of the no Trump administration. Thank you. Have a wonderful rest of the day, everyone.
Bye-bye.
Okay, bye-bye. It was a pleasure. Thanks for having me.
Thank you.